Welcome back to my channel. Let's look at the anal canal. This lecture will be limited to just the interior wall of the anal canal. The anal canal is the terminal region of the gastrointestinal tract. This is where we have the rectum, and inferior to the rectum, we have the anal canal. And this is the anal canal here marked in black. This anal canal is about 4 centimeters in length or about 40 millimeters in length. The anal canal is also seen to be directed posteriorly. So using this image here, this is the rectum, and inferior to the rectum, we know we have the anal canal, and this is the anal canal. You can see that the anal canal at this point is directed posteriorly, and this direction is as a result of the curvature that is created around the anorectal junction. The anorectal junction is junction between the rectum and also the anal canal. You see that a curvature is created around this point, and this is what leads to the posterior direction of the anal canal. This curvature created at the anorectal junction will become straightened so that there will be easy passage of physics. So this curvature will not be as what is presented here during the process of defecation. It will become straightened or more vertical so as to allow for easy passage of physics. So we can say that the anal canal begins superiorly at the anorectal junction. This is the anorectal junction here marked in red. We already said that it's a junction that is created between the rectum and also the anal canal. And inferiorly, it is limited by the anal orifice or the anus. And this is like a guide of the anal canal. The anal canal is located within the anal triangle, just as the name implies. Let's use this image here. Let's say this is the configuration of the perineum. We know that the perineum, in the anterior part, we have the urogenital triangle. This is the urogenital triangle in the anterior part. Within the urogenital triangle, we have the urinary organs and also the genital organs. And posterior to the urogenital triangle, we have the anal triangle. And within the anal triangle is where we have the anal canal. And this is the anal canal here highlighted in blue. On both sides of the anal canal, we have the ischioanal fossa. And this is the ischioanal fossa here, arrowed in green. Within the ischioanal fossa, we have fatty tissue that helps to give structural support to the anal canal. So going further, let's look at the functions of the anal canal. The anal canal helps to maintain fecal continence, which means that it helps in voluntary elimination of the physics. We know that the anal canal is guided by the sphincters, and one of the anal sphincters is under voluntary control. So we are able to control the elimination of physics on our own so that physics is not leaked out of the anal canal or released uncontrollably. So we're able to have control over the release of the physics through the anal canal. The anal canal also enhances the process of defecation. We already described the creation of an angulature between the rectum and also the anal canal in this region. We said that this angulature is at the anorectal junction, and this is highlighted here in black. The degree of this angulature tends to increase during the process of defecation, so that the anal canal will be more straightened. And if it is more straightened, it's going to allow for easy passage of the physics. So this angulature created here between the rectum and the anal canal at the anorectal junction, the degree of this angle will be increased so that the anal canal will be more straightened. And as it becomes straightened, it's going to allow for easy passage of the physics. So that is how the anal canal also helps to contribute to the process of defecation. Also within the anal canal, we have anal glands. This anal gland secretes pungent fluid. The strong smell or odor that is produced by the pungent fluid that is secreted by the anal glands is used by other mammals, such as dogs, to mark their territory. And this will help to sensitize predators of the awareness of their environment. Also, the anal gland is responsible for the secretion of mucus. So as mucus is produced by the anal gland, it is released into the lumen of the anal canal. And this helps to lubricate the interior wall of the anal canal so that the passage of the physics will be easy. So now going to the internal wall of the anal canal, this is where this lecture begins. The internal wall of the anal canal is initially divided into 2 subregions. Let's say this is the configuration of the anal canal. It's demarcated at this point, highlighted in red. This region is the pectinate line or the dentate line. Above the pectinate line or the dentate line, we have the upper 2/3. This is the upper 2/3 here highlighted in red, and below the pectinate line or the dentate line, we have the lower 1/3, and this is the lower 1/3 here highlighted in black. The upper two-third is about 25 millimeter in length, while the lower one-third is about 15 millimeter in length. So that is the initial subdivisions of the anal canal. If you look at this image down here, this is the entire configuration of the anal canal marked here in blue. This is the rectum, and below it is where we have the anal canal. There is an initial division of the anal canal into the superior two-third and also the inferior one-third. And this is at the level of the pectinate line or the dentate line. And this is what is highlighted in red. So above this region is where we have the upper two-third, and below the pectinate line we have the lower one-third, and this is what is represented. And then there is a further subdivision of the lower one-third of the anal canal, and that is what we'll be looking at now. So the lower one-third is further subdivided into the middle part or the transition zone, and also the lowermost part. So using this image up here, we already have the superior or the upper two-third and the lower one-third. So the lower one-third is what is subdivided into two, and what divides it into two is the Iltis white line. So this is the demarcation here by the Iltis white line, and this Iltis white line is at the level of the intersphincteric groove. We'll be getting to this groove as we go further with this lecture. So at this point, we have the lower one-third being further subdivided into two. We have the middle part or the transition zone, and we have the lowermost part. So also using this image down here, we already have the upper two-third and the lower one-third. It is the lower one-third that is further subdivided into two. So at this region is where we have the Iltis white line. And this Iltis white line is at the level of the intersphincteric groove. The intersphincteric groove is the groove that is created around the lower limit of the internal anal sphincter, where it forms an intercept with the external anal sphincter. And this is the level where we have the intersphincteric groove. And this intersphincteric groove is located at the inferior limit of the internal anal sphincter, where it forms an intercept with the external anal sphincter. This is the internal anal sphincter here, just as the name implies. It's seen as the internal part, and we have the external anal sphincter here highlighted in green, which is located at the external region, just as the name implies. So we have the internal anal sphincter and the external anal sphincter here, and we have the region where this groove is created, and this groove is created at the most inferior limit of the internal anal sphincter, where it forms an intercept with the external anal sphincter, and this is the region here. And this region tallies with the level where we have the Iltis white line, and this is the Iltis white line, which also further subdivides the lower one-third of the anal canal into the middle part of the transition zone and also the lowermost part. And this is the middle part or the transition zone, which is the transition between the upper part and also the lower part of the anal canal. Then we have the lowermost part here. So this is how the anal canal is subdivided into the different subregions that it is made up of. We have an initial division into two subregions. Then the lower part further then subdivides into two. So let's take each of these subregions one after the other to see what they present. So for the upper region, which is the superior two-third of the anal canal, this is bounded superiorly by the anorectal junction, and inferiorly it is limited by the pectinate line or the dentate line. We already presented this in our previous slide, that the pectinate line or the dentate line is what initially divides the anal canal into the superior two-third and the inferior one-third. So this is where we have the anorectal junction at the upper part, and inferiorly we have the pectinate line or the dentate line. So this is the region that is marked as the superior or the upper two-third of the anal canal. And this region is of endodermal origin, which means that this region is developed from embryonic endoderm. And this region is also lined by simple columnar type of epithelium, which is the epithelium lining of the gastrointestinal tract. You can see that this region is the upper region, and this epithelium lining the gastrointestinal tract is what is also seen to line this region, because it is located close to it. So the epithelium lining of the gastrointestinal tract also continues down at the upper part of the anal canal. So going further on the upper region, there's still more fact that is needed to be unfolded on the upper two-third of the anal canal. The internal wall of the upper two-third or the superior two-third of the anal canal is lined by mucous membrane that is thrown into longitudinal folds. So you see folds of mucosal lining of the upper two-third of the anal canal, and these are referred to the anal columns of Morgagni, and this is what is harrowed here in black. You have a number of them. They are usually about 6 to 10 in number, and that is what is seen to be presented. They are just longitudinal folds of mucous lining of the wall of this region, and this is what is presented here. Within the anal columns of Morgagni, we have branches of the superior rectal vein. We know that the superior rectal vein drains the superior part of the anal canal, and it drains it into the portal venous system. So when we have portal hypertension, there's going to be the enlargement of this vein because the branches of the superior rectal vein are contained within these folds. So in the case of portal hypertension, this region is usually the site of internal pile, and we know that pile occur as a result of enlarged vein. So when there's portal hypertension, it's going to drive the tension into expanding the branches of the superior rectal vein that are contained within the anal columns of Morgagni. So between the anal columns of Morgagni, we have spaces that are referred to as sinuses, and these are called the anal sinuses. So we have the anal sinus here arrowed in blue. Also, we have the anal valves. The anal valves are seen at the inferior limit of the anal sinuses. We have the anal valve here. This valve, you can see it at the limit of the anal sinus. This is the anal column of Morgagni. And in between the anal columns of Morgagni, we have the anal sinus. Then inferior limit of the anal sinus is where we have the anal valve. The anal valve is at the lower part or the lower limit of the anal sinus, just like a guide seen at the inferior limit of the anal sinus. It's also referred to as the valve of Ball. Some can say that it helps to hold the anal columns of Morgagni. It depends on how you want to view it. This is the anal column of Morgagni here arrowed in black. And if you see one anal column of Morgagni, this is another anal column of Morgagni. You can see the anal valve linking or connecting the two anal columns of Morgagni. So it depends on how you want to see, because the anal sinus is created as a space between the anal columns of Morgagni. So it's seen at the inferior limit. And also because it is seen at the inferior limit of the anal sinus, it is also seen to connect the two anal columns of Morgagni. Also to add, if you look at the level where we have the anal valves, you see that it aligns or tallies with the level where the pectinate line or the dentate line is established. Remember, we talked about the pectinate line in our previous slide, where we established that it divides the anal canal into the superior two-third and the inferior one-third. And this is the pectinate line or the dentate line here highlighted in green. And if you look at the level where the anal valves are seen or are formed, you see that it tallies with the level of where we have the pectinate line, just for us to know this. We also have the anal glands. We already established what the anal glands do in our previous slide. The anal glands are rudimentary in humans, but are well developed in other mammals such as dogs. And we've tried to establish the function of this gland in our previous slide, where we said that they produce pungent fluid that helps to mark their territory. It also secretes mucus that helps to lubricate the internal wall of the anal canal. So we have the anal gland. This is the anal gland here, arrowed in red. We have one on this side and we have another one on the other side. The anal glands are seen within the anal sinuses. And this is also where they open their secrets into. And through this, it is able to flow within the internal wall of the anal canal. So going further to the next sub-region is the middle region. This is also referred to as the transition zone. So it's like a point where there's a transition in terms of the configuration presented within the interior wall of the anal canal. And it is seen between the pectinate line and also the Hilton's white line. So this is the pectinate line up here. The pectinate line, we already established that it marks the limit of the superior two-third of the anal canal. And inferior to that, we have the Hilton's white line, and this is the Hilton's white line here, also arrowed in blue. So in between the pectinate line and also the Hilton's white line, we have the middle region of the anal canal or the transition zone. This is a sub-region of the lower part of the anal canal. Remember, the anal canal is divided into an initial two sub-regions, the upper two-third and the lower one-third. With the lower one-third is then further subdivided into the middle or the transition zone or the lowermost region. So the middle region is where we have here, and you see that this region is sandwiched between the pectinate line and also the Hilton's white line. So this is the region here marked in black. This region is of ectodermal origin, which means that it originates from the embryonic ectoderm, and it is seen to be lined with not keratinized stratified squamous type of epithelium. We know that stratified squamous epithelium are epithelium lining of the skin, and we know that this region is gradually getting to the external part. So the epithelium lining the skin is also continuous within this part, and that is why it is seen to be lined with the stratified squamous type of epithelium. But the stratified squamous type of epithelium that is seen in the transition zone is not seen to contain sebaceous gland and also sweat gland. The stratified squamous type of epithelium that is seen to line the middle of the transition zone of the anal canal is not seen to contain sebaceous gland and also sweat gland. So they are not also seen to be thrown into folds as is presented in the upper two-third, where we have the presentation of anal column of Morgagni. This is not presented within the middle or the transition zone. Then going to the next region is the lowermost region. The lowermost region is also a subdivision of the lower one-third of the anal canal. Remember that it was initially divided into two sub-regions before the lower part is further subdivided into two. We talked about the middle or the transition part. Now we're talking about the lowermost region of the anal canal. The lowermost region of the anal canal is seen below the Hilton's white line. This is the Hilton's white line. The Hilton's white line marks the inferior limit of the middle or the transition zone, as we described in our previous slide. So inferior to the Hilton's white line is where we have the lowermost region, and this is further guided by the anal orifice or the anus. And this is what is harrowed in black, is where we have the lowermost region of the anal canal. And this is part or a sub-region of the inferior one-third or the lower one-third of the anal canal. And this region is also of ectodermal origin, just as we have in the middle of the transition zone. The lowermost region is seen to be lined by the epithelium of the true skin. And we know the epithelium lining the true skin is a keratinized, stratified squamous type of epithelium. And that is what is seen to line the lowermost region of the anal canal. The keratinized stratified squamous type of epithelium, because it's the epithelium lining the skin, is seen to contain sebaceous gland and also sweat gland, and also sometimes maybe hair. So the epithelium lining the skin is seen to be continuous with the epithelium lining of the lowermost region of the anal canal, and that is why it is seen to be lined by a keratinized stratified squamous type of epithelium that is seen to contain sebaceous gland, sweat gland, and also hair. The lowermost region of the anal canal is also seen to be corrugated or ridged appearance, and this corrugated appearance is formed by the corrugator cutis ani muscle. This corrugator cutis ani muscle is a smooth or involuntary type of muscle. This we'll discuss in a subsequent lecture on the anal sphincter. Please do watch out for this, where we'll be giving a detailed explanation on the corrugator cutis ani muscle. Just a bit on the corrugator cutis ani muscle. This muscle is formed from fibers of the external longitudinal layer of the gastrointestinal tract. We know that the gastrointestinal tract is lined by the inner circular layer and the outer longitudinal layer. The outer longitudinal layer of the gastrointestinal tract is seen to send its fibers to the lowermost region of the anal canal. And that is what is responsible for the formation of the corrugated appearance that is seen at the outer presentation of the anal canal. So having gone through the different regions of the anal canal, we know that the anal canal is initially divided into the upper two-third and the lower one-third. So this slide, we are going to be tabulating the differences seen between the upper two-third and the lower one-third of the anal canal. In case we are asked during exam, this is a common question during exam where you'll be asked to state or highlight the differences between the upper two-third and the lower one-third of the anal canal. So I've decided to create a table to answer this question. So let's say this is the configuration of the anal canal. We know that at the level of the pectinate line or the dentate line, we have the upper two-third, and below it, we have the lower one-third. So looking at this, the upper region, of course, will be above the level of the pectinate line. This is the pectinate line here highlighted in red. So the upper two-third is definitely above it, while the lower one-third is the region below the pectinate line. The second difference would be that the upper two-third develops from embryonic endoderm. stated this in our previous slide. And also the lower region developed from the embryonic ectoderm. Also, the upper two-third is supplied by the superior rectal artery, which is understandable. The superior rectal artery is the branch of the inferior mesenteric artery. And we know that the inferior mesenteric artery branches from the anterior surface of the abdominal aorta. While the inferior one-third or the lower one-third is supplied by the inferior rectal artery, which is a branch of the internal pudendal artery. And we know that internal pudendal is a branch of the internal iliac, which branches from the common iliac. And the common iliac is a terminal branch of the abdominal aorta. We should be able to trace the artery down to the point where they originate from. Then the next difference is the venous drainage. The venous drainage of the upper two-third is into the portal venous system, while the venous drainage of the lower one-third is into the systemic venous system. Then going to the lymphatic of the upper two-third is through the internal iliac lymph nodes, while the lymphatic of the lower one-third is through the superficial inguinal lymph nodes. Then innervation of the upper two-third is through the autonomic nervous system, while the lower one-third is through the somatic innervation. Then talking about the epithelium lining, the upper two-third is simple columnar epithelium, which is epithelium lining the gastrointestinal tract, while epithelium lining the lower one-third is stratified squamous type of epithelium, which is epithelium lining the skin. So let's go to the relations, the structures that are related to the anal canal. Anterior relations of the anal canal are different for both the male and the female because of the differences or the peculiarities of the reproductive system. The male and the female reproductive system are not the same, and that is why we have different organs related to the anal canal anteriorly. But there is a structure that is common to both in terms of the anterior relation, and that is the perineal body. So we have the perineal body located in the anterior part of the anal canal in both the male and the female. For the male specifically, in the anterior relation of the anal canal, we have the membranous urethra. Then we have the bulb of the penis. The bulb of the penis is the root of the corpus spongiosum. So it is at the anterior part where the corpus spongiosum is rooted from or originate from. It's also seen to be anteriorly related to the anal canal. For the female, the structures that are related to the anal canal anteriorly is the lower end of the vagina. The structures that are related posterior to the anal canal are the same because the reproductive system are not seen to be located posterior to the anal canal. They are only seen to be located anterior to it. And that is why we have the same organs or structures related posteriorly to the anal canal. And posteriorly, we have the anococcygeal ligament and also the tip of the coccyx. So this is the coccyx here, and the associated ligament, which is the anococcygeal ligament, is seen at the posterior part of the anal canal. This is the anal canal here, highlighted in blue. And laterally, what we have is the ischioanal fossa. And this is the ischioanal fossa here, arrowed in black. We already highlighted this fossa in our previous slide where we said that within this fossa we have fatty tissue. The fatty tissue that is contained within this fossa helps to give structural support to the anal canal. These are the structures that are related to the anal canal. So thanks for watching. Let's meet again.